An app for mobile phones aimed at tracing the spread of coronavirus is to be tried out on the Isle of Wight this week, before being rolled out more widely across the UK later this month. Between 50 and 60% of the population will have to use the software for it to be effective. Duncan Kennedy reports now from the Isle of Wight.
Surrounded by water and isolated enough for a credible experiment to take place, the Isle of Wight trial is set to begin. The island is home to 140,000 residents. Nearly 30 people have died with the coronavirus. The new app uses a phone's Bluetooth connection to work. Once you've installed the app, every time you come into contact with someone else who has it, your phones record that fact. Then, if you tell the app you have symptoms of coronavirus, that will alert the phones of those other people. They will then need to self-isolate. So what do those on the Isle of Wight think?
The more people that get involved, the better. The only problem is that probably a lot of people don't have a smartphone. That could be a problem, I fear.
I think it's a good idea, and I think if it's going to work, it is a good place to try it.
I feel that the island is essentially being used as a testing ground, and don't like the thought of us being used as guinea pigs.
The app should help automate the whole process of finding out who has the virus. But getting it to enough people won't be easy.
For the app to work properly, it needs something like 50 or 60% of the population to take part in it. Here on the Isle of Wight, that's about 70 or 80,000 people. Anything less than that, and the experiment won't be valid, and the virus won't be traceable.
The government says if the app works on the island, it will get a national rollout.
We will be asking the whole country, where possible, to download this mobile phone app, which will help automatically to remove the need for individuals to be involved.
The government will also recruit 18,000 people to help with the tracking of individuals once the app is in place. Like social distancing, this is another enormous national endeavour to try to rein in COVID-19 with technology and science. Duncan Kennedy, BBC News, on the Isle of Wight.
Our health correspondent Dominic Hughes joins me now from Salford. Dominic, tomorrow we enter our 7th week of lockdown. How do you read the signals from ministers today?
Well, Reeta, I think that ministers are slowly but surely moving towards providing some answers, at least, about that big question. How do we get out of lockdown without risking a second spike in both deaths and new infections? Now, in order to get there, they want some conditions to be met. They want sufficient capacity in the NHS. They want issues around PPE, personal protective equipment, and testing to be in hand. And we learned today that the government missed its own self-imposed target of 100,000 tests to be carried out each day. We know yesterday only fewer than 80,000 tests were carried out. Ministers blame that on the weekend effect. They also want a consistent fall in deaths and a consistent fall in new infections. And we have a graph that will shed some light on that last point. It shows how the number of people being treated in hospital in the UK has fallen by 2,000 in the past week to around 14,200. Now that is a really significant decline of 13%, and most noticeable, Reeta, in London, the epicentre of this latest breakout, where it has halved since the middle of last month. Now, why does this matter? Well, it shows that the R number that we heard about earlier in the bulletin, this rate of transmission to person, is declining. And that's important because that is a vital condition that has to be met if we're going to get out of lockdown anytime soon.
Dominic, many thanks. Our health correspondent Dominic Hughes there. The deadline's just passed for businesses to respond to the government's draft proposals for workplaces to reopen safely once the lockdown is eased. Our business correspondent Katy joins me now. Katy, do we know what's in these proposals?
Well, businesses really want to know what the world of work should be like once eventually the economy does start to reopen, both so they can plan and so that they can reassure their employees and maybe customers that they are doing things the right way, the safe way. Now, while the government has been drawing up its guidance, it has had input from business groups, from trade unions, from leading firms as well. And today they received the draft guidelines to have a look at. And yes, the deadline for them responding to those has just passed. And then over the coming week, we expect the government or the Department for Business will start to outline its approach to reopening certain types of workplaces. We're talking about practical proposals, for example, staggering employee arrival times or things like extra hygiene measures or screens where appropriate, because even if the economy does get going fairly soon, or if a date is set, no one expects a swift return to normal.
Katy, many thanks.